Welcome to JAT Chat, presented by the Journal of Athletic Training, the official journal of the National Athletic Trainers Association. I'm Dr. Shelby Baez, an assistant professor in the Department of Exercise and Sports Science at UNC Chapel Hill, and the co-host of JAT Chat. Today, I have the pleasure of being joined by Dr. Beidler. Dr. Beidler is an associate professor in the Department of Athletic Training at Duquesne University. She is author of Concussion-Related Anxiety Perceptions of Parents of Youth Athletes, published in the Journal of Athletic Training. Erica, thank you so much for joining me today.
Thanks for having me.
So starting with a very broad question for our listeners, can you define concussion-related anxiety perceptions and just briefly discuss the importance of examining these perceptions in parents?
Absolutely. So when we're thinking about anxiety, we can kind of put it into two buckets. One would be a clinical diagnosis of state or trait anxiety. What I'm more interested in with perceptions is more of the social side of mental health. So when I talk about concussion-related anxiety perceptions, I'm really wanting to know what people think and feel about concussion. And I'm interested in that because some of these more informal thoughts and feelings will drive behaviors. So when we're talking about, think more of a social impact. It's not quite as clinical as like state or trait anxiety. So we're looking at fear, worry, being upset, and feeling anxious within this study. And the reason why it's important to look at this, I actually want to share just a quick story about why I got interested in this topic. So I was in my last year doing my PhD at Michigan State University, and I was assigned to cover youth football, 4th grade through 8th grade, youth tackle football as part of the Daedalus injury surveillance program. So shout out to Daedalus for that study. So I was spending some time with youth football, and I hadn't been on the field clinically in quite a few years. And I had a 4th grader. I don't know who might have 4th graders that are listening, but it's kind of hard to get a read on a 4th grader. But they did bump their head and were reporting symptoms to me. So I was being cautious and did diagnose them clinically with a concussion. So I called the parent and I started talking as your child has sustained a concussion today during practice. And I was talking to a mother, and she immediately started to get emotional when I told her that. And I said, your child's going to be okay. And then she responded immediately, like, how is he going to be okay? He has a concussion. He could get CTE from this. And that really put me back on my heels, that a parent of a 4th grader who may or may not have had a true concussion was thinking along those lines already. So that really kind of keyed me into the importance of how people think and feel about concussion from a social aspect. And I also think it's why we need to talk to parents about this. If you are looking at any type of mass media talking about concussions, you're going to see that hand in hand with these stories about CTE and long-term issues. And the fact of the matter is, our science is behind those stories. So the media is kind of running with these storylines because it makes a good story. But that is what parents and athletes are seeing, is those public media outlets talking about that. We also now have professional athletes making claims that, oh yeah, I probably have CTE. And they're joking about it. But that's a really dangerous narrative to throw out there about something we really know very little about in the big picture. So that's why I think it's important to talk to parents about their perceptions, to get an understanding really of what they're thinking and feeling, because we want to encourage sport participation and we want to encourage them to seek care when needed. But there has to be some sort of fine balance between understanding concussion is serious versus overinflating the potential ramifications that we really know nothing about at this point.
Well, I certainly appreciate you sharing that story from your clinical experience, because I think that's really impactful, and it definitely leads to the need for a study like you've completed here for the journal. What was previously established related to demographics and potentially identifying those who may have greater concussion-related anxiety perceptions in these parents?
I think that's a really good question. So when I dove into the literature to understand concern, a lot of the narratives were really focused on this decrease in tackle football participation. And there was also some studies in soccer. And one study particularly, the largest, was looking at parent concerns from the general population. So some of the factors that study particularly found was that parents who were identified as Black or Hispanic had greater concerns related to concussion. Those with a lower level of education, those lower in socioeconomic status, those were some of the risk factors that they identified as having greater concussion concerns. When it comes to sex or gender differences, the literature was kind of split on it. And really, it was looking mostly about concern about concussion specifically. Some found some parental differences between men and women, others did not. But in general, we do know that mothers or women tend to have higher anxiety overall. So that was something that was interesting that it's kind of split within the literature. There's also some previous literature that was suggesting that concussion education, like having had concussion education, could help lessen these concussion-related anxiety thoughts and feelings in parents. But a lot of it was smaller sample sizes, cross-sectional in nature, and not always sport specific or broad sports, more than one sport.
So, along those lines, with some of the gaps that you've identified in the literature, can you tell us a little bit about your study design and how you address some of those gaps in the literature with your particular study?
Absolutely. So, like I said, most of the previous research was looking kind of at this idea of being concerned, which was not really a robust measurement of perceptions, in my opinion. But I do want to give some kudos to those founding articles that did look at concern because that planted a seed with me to want to dive into this more broadly. So, given that, I went and looked for different measurement tools for injury and illness perceptions, and so be it. There is an injury and illness perception questionnaire that's existed since the 1990s. So, we took that and we made it concussion specific. And for the larger study, we altered that to be geared towards parents and put in the context of concussion for their child. And then we also did a child companion study that we're working on a manuscript right now, where we worked with the reading level to get it down to a sixth grade reading level to actually gauge the youth athletes' perceptions too. So I've been using that tool quite a bit. And then we wanted to think more mindfully about the population, not just football or soccer. So we looked at football, soccer, ice hockey, and lacrosse, which tend to be higher concussion risk sports. So we broadened that out a little bit. And we also did some capture at two different geographical locations in central Michigan and in southwestern Pennsylvania. So we kind of broadened out from there. So that is kind of what our approach was for this particular study. Because this was my first dabble in perceptions, these were all healthy children. So these were not post-concussion measurements. So this is more just generally throwing it out there. How you feeling about this injury? And the illness perception questionnaire is pretty cool because it also gauges their understanding, like their self-perception of their level of knowledge. It includes their beliefs about treatment efficacy and beliefs about personal control over injury symptoms. So there are additional constructs that we didn't include in this particular article that you can get from that perception questionnaire that we're still exploring.
It's always exciting when there's a questionnaire that you find that previously exists that works for your particular study question. Uh,
Yes.
so tell us, what did you find? What did you find regarding the prevalence of concussion-related anxiety perceptions and some of the associations with demographic variables, concussion history, previous concussion education, etc.?
This will not be a surprise to the practicing athletic trainers that might be listening because I think that they're seeing these concerns every single day while they're practicing. But we saw a meaningful percentage of parents feeling anxiety about this. Particularly, we saw 73% of respondents agreeing that they were upset at the thought of their child sustaining a concussion. 61% were fearful of their child sustaining a concussion. 45% reported that the thought of their child sustaining concussion made them feel anxious. And our reverse scored item was looking at worry, and only 4.7% of respondents said that they did not worry at all about concussion. So when we looked at that reverse, about 75% would have shown worry when you kind of look at that one in the opposite direction. So that was kind of when we looked at the individual anxiety perception items. We also then did a composite score by summing the Likert responses to these particular items within this questionnaire. So the range would have been from 4 to 20, and the average for that was a 15. So more on the higher end of that range comparatively, but then our quartile range was 13 to 17, but in general, we saw it to be a bit higher. So just looking at those basic frequencies, it's showing that there is some sort of emotional burden going into this injury. To be fair, we did not look at other injuries like ankle sprains and ACL injuries. So we can't really say that it's more than another injury, but it's clear that they're here. So I think that that's important. And again, these are here without their child actually sustaining an injury. So something to note. Then we started to dabble into a few different variables that could have potentially impacted these thoughts. So we looked at sex, so males versus females. We looked at personal concussion history of the parent, so whether they personally had sustained a concussion or not. We looked at child or family concussion history, so if any of their children had ever sustained a concussion. And those were important for us to look at to understand their lived experience. Had they ever actually lived through a concussion or lived through the management of a concussion for their child? So those concussion history questions were key. And we also did gauge, had they ever received concussion education in the past? So a little bit more before I tell you kind of the outcomes of that, of our sample. So we did have 60% that reported being female, so more mothers or female guardians than men. When we asked for personal concussion history, only 11% of our respondents said that they had personally sustained a concussion in the past. For if any children in their family had ever sustained a concussion, that was 17.5%. And only 36% had reported receiving concussion education previously. So that's kind of just a frequency breakdown of those factors. But when we used our regression analyses to look at that, ultimately what we found is that female parents and those parents who had not sustained a concussion previously were more likely or have greater odds to have concussion anxiety perceptions compared to men and those that had had a concussion before. So when we kind of put that in the context of the broader literature, and especially the psychological literature, the finding of mothers tracks. Women, we tend to have more anxiety about things. We tend to maybe think more deeper, especially with the literature looking at mother anxiety related to their children's health. So that was very much in alignment with those findings. The interesting finding to me was that those that did not have a concussion in the past had that anxiety. And I think that gets into this concept of the fear of the unknown, right? Like you can, if you've never experienced something, you can create whatever narrative you want in your brain, but it might not actually match the reality until you actually go through it. So that's just an interesting finding that I like to kind of think about, this like idea of fear and not knowing. And that's a very natural process in life that we've all felt in certain circumstances. So both of those do make a lot of sense. But interesting, we did not see the child concussion history or having received concussion education to matter much. So those were a little bit interesting findings, especially that concussion education, because in our brains, we think that's going to help them. But we really found it not going either way with that variable.
Well, I appreciate you explaining those results. The fear of the unknown and perception being reality for so many folks across these injury experiences is something that I think we have to consider, especially working clinically as an athletic trainer. I also really appreciated that you started this answer off by saying athletic trainers probably won't be shocked by these results. And thinking about athletic trainers, what are some recommendations that you may have for athletic trainers based off the results of these studies?
I think that's the most important part of all of this. So how do we use this information to inform practice? First, I do want to conceptualize a little bit more about our sample. Our sample, they were recreational use sports. So they likely did not have access to an athletic trainer. That is a bigger problem we need to solve as a profession because it comes down to $1 to have us be available for them for care. So that's one side of it that I did want to mention. For those that are working with middle school athletes, I think it's important to remember they might be coming from a recreational environment where they did not have a healthcare provider to now having access to you in the secondary school setting. So one of the biggest recommendations I would have, especially at that transition point, maybe that first interaction you might be having with parents in the middle school setting, if you have access to them, is asking them what they think and know about concussion before you deliver any sort of information to them. And that could be if you're doing proactive education or if you're doing post-injury education. Before you start rattling off your concussion script to them, just stop and say like, "Hey, have you ever experienced a concussion before? Has your child? What do you know about this?" Because that can help inform what you say to them and how you tailor your message. So although we found this finding with women, I don't want us to think that we need a sex-specific message for parents. We need to be thinking personalized healthcare, person-centered care. This is a big element of psychologically informed care, of starting right at ground zero, and hearing what they have to say and what they know first. So that's probably my biggest recommendation for them is that. Then once you get a gauge on what they're thinking and feeling, if you hear things like CTE and long-term issues getting thrown around, I think that's an awesome opportunity to flex your brain power as a clinician. As an athletic trainer who is the community level point person for concussion, you can come in and you can say, hey, let's talk more about that and give them some information about the current state of scientific literature. We might not know for 10 to 15 years what is really leading to CTE. There's some proposed things happening, but the research is being done currently right now to help us answer some of those high level questions. So I think you can kind of come in and talk about that, as well as promoting those positive benefits of sport, both physically, mentally, emotionally for children. So, although you might not want your child to play tackle football, there are plenty of other ways to keep them physically active. So, I think that's kind of a main thing we need to be thinking about is safe sport engagement and that there's other options out there if parents aren't feeling comfortable with the collision options that might be available at their school districts.
So, what I'm hearing is the importance of educating and involving all stakeholders throughout the process.
Yes, absolutely. And I get a sense, Shelby, that you've read our bridge statement on concussion that came out because that's almost verbatim one of the recommendations that got updated from the position statement. So definitely more engagement on the educational side with the actual people that we're trying to educate. So tailoring the message to their needs. And you can do that at the individual level in one-on-one conversations, especially post-injury, or more broadly by understanding the needs of your population a little bit more on the front end.
Awesome. And my last question for you is, can you provide a take home point about your paper for our listeners?
Take home point. I think it's to ask the questions. I think it's to be okay talking about mental health and actually engaging people in their thoughts and feelings about things. Sometimes that's a skill that some people have really naturally, others have to work really hard to cultivate that. But at the end of the day, if we try to just frame that this injury isn't happening to us as a healthcare provider, it's happening to our patients and their families, and kind of gauging where they're at in the process will really help strengthen our approach. And when I think about athletic training and I talk to students and parents, that's what makes us cool. That's what makes us unique. We are at the community level. There are very few healthcare providers that interact with their patients every single day. On sometimes it can be exhausting. But on the other side, when things do come up like this, you can really read the room, read the patients, read the communities you're serving, and be able to make an impact for them long term. So I think that we can lean into the thing that makes us special when we're thinking about the ability to provide psychologically informed care because we have the opportunity to do it really well.
I always say we get to know our patients before they formally become our patients, which is a really unique thing about our profession.
Yes, and they can never hide anything from us, really. But especially like working with parents, each family unit is gonna have their own challenges and strengths. And being able to get to know people and help them through the process, I think is really powerful, especially with this injury particularly that is so villainized in the mass media. I think we can make a really large impact just by using our strengths, and that's talking to people and building those relationships.
Absolutely. Well, Erica, thank you so much for joining me today. This article is available free of charge by the Journal of Athletic Training. I highly recommend everyone go and download this manuscript in the journal. Again, thank you so much, and we will see you next time.
Thanks for having me.